Hello guys, and welcome to this video to understand why some cases that have underextended root canal treatment just don't get lesions. Okay, so some cases the root canal treatment is underextended, so it didn't get to the end of the apex, but sometimes nothing happens, or periodontal ligament space widening will happen, which indicates also inflammation and alterations in the periodontal ligament space. But sometimes the cases just stay like this, and it's actually a stable clinical situation. So why those things happen? And here I'm recommending a very nice reference for you guys as well. And then we have three cases for us to understand this situation because they are different. So let's start with case one. And again, we have here underextended root canal treatment. Okay, we're not going to comment all the case, the entire case, the medical conditions and everything, because that's actually too much. But then we need to understand some situations here. Those are two different sagittal slices, of course, because that's basically it's an oblique plane, but they are showing you mesial distal dimensions here, right? So basically you have here two different slices, and in both of them you can see that we have periodontal ligament space widening. Okay, so this is common because the root canal treatment is underextended, and then at the end of the apex there are still bacteria, and that's basically leading to inflammation, but maybe not enough for us to have a lesion. Okay, and we are going to understand why very soon. But here we also have the vertical bone defect. Okay, there are a lot of artifacts. That's actually a CBCT, so that's why it's tough to diagnose. For example, fractures. The resolution here is actually not the best one either. The other planes are not helping us a lot. Also, in the axial plane, you guys are seeing the artifacts. So those are strake artifacts, the ones leading to those lines that are radiopaque or hyperdense now, because that's CBCT. Okay, and then we have here this situation. Okay, so you could follow up, for example, but this could also be some fractures that are still starting to develop. Don't forget that fractures, the end of the fracture usually leads to periodontal ligament space widening at this area. Okay, so that's also very important. Here, it doesn't seem to be the case. Maybe it's a oblique canal, or just the like a divergent root canal here. So, and then there you have it. You have the periodontal ligament space widening happening here. Okay, you can follow up, but you need to correlate this with the clinical situation always. So do we have tenderness to percussion? If yes, then we suspect even more about fractures, okay? But then this is a CBCT, and if the CBCT has a good resolution, you guys would be able to diagnose, or at least most of the fractures you guys would be able to diagnose, okay? Sometimes the CBCT won't detect the fracture. That's also described by the literature, okay? So it depends on the cases, but at least nowadays with those modern CBCT devices, fractures and even cracks are detectable by CBCT. Okay, case number two, take a look at this. The root canal treatment is completely underextended, okay, but nothing is happening here. Okay, so here it's a little bit more radiopaque, but that's actually the difference between the beginning of the symphysis of the mandible. It's a little bit more anterior than this, but here the posterior trabecular bone has this pattern here, right? So that's the posterior trabecular bone, and then you have increased trabecular spaces, but that's actually just an anatomical variation. We need to understand that the periodontal ligament space is not widened, or at least it's in a in a normal situation here. If we have a little bit of radiopaque area more condensed than this, it could be condensing osteitis, for example, and then you would follow up at least the case, right? But why some cases don't get inflamed like this? Well, it's very simple. Sometimes those cases that are not getting periapical lesions or inflamed, usually pay attention because that's very important. Usually they are cleaned. When the root canal is cleaned, the root canal is cleaned always to the same level. Okay, so imagine this. I will even draw here for you guys to understand. So that's the entire case, of course. And then, okay, so take a look at this. So the first endodontic file came through to clean the root canal until here only. Okay, the second endodontic file came until here. The third, so all of them came until here. All right, and of course the caries were here, but maybe the pulp was not necrotic yet. So it was indicated for endo, it was cleaned, but the pulp was not entirely necrotic. And then, of course, this is still a situation that you don't have a lot of bacteria at the apex now. Okay, the problem is when you clean until the end of the apex, so you actually cleaned with the first endodontic file, for example, or the rotatory instrument, but then the obturation stays underextended, okay, because now of course, there are bacteria that was pushed towards the apex, and then even the rests of dentin that you are removing from during the root canal treatment itself, and now you only obturated until less than this length, okay? So now you obturated shorter than what you actually tried to clean in the beginning. And then those cases, usually you have the lesions. So that's a very nice clinical tip, okay? Not only based in scientific information, but also in clinical experience. Let's see the other case here, and then we have here a root canal treatment, which is not even, you know, maybe a little bit underextended, but it's almost at the level of the apex. And then you have, well, this could still be classified as periodontal ligament space widening, but versus periapical granuloma, right? Because now we do have a situation here that it's a hypodense lesion, okay? So it's the beginning of a periapical granuloma, all right? And that's basically what happens. The periodontal ligament space, widened space, becomes now a periapical granuloma. This is a chronic situation that can become acute as an abscess. The abscess can chronify to a periapical granuloma, and then these can develop to a cyst as well. So those are normal changes that we can see on periapical lesions. Okay, so periapical lesions can undergo those changes. But here, what else happened? Now we have a fracture. Okay, and that's why we have loss of the buccal plate. Okay, so that's the palatal plate here, and that's the buccal plate. The pink arrow is on the buccal plate, showing that at the limits of the fracture, not only the periodontal ligament space is widened, but now even the bone is gone because the buccal plate is very thin most of the times. Okay, and that's actually what's happening here. So you have this situation here. Now there is a fracture, and this contributes. Now maybe we have a longer fracture, even a vertical fracture like this. So we are going to analyze all the three planes. If you guys don't remember how to navigate through CBCT properly, the link will be on the top right corner of this screen. It will show at some point on this video. But of course, then you guys would detect the fracture. But here we have a lesion, so you can follow up. If there are no symptoms for this patient, you could follow up, okay? But the ideal situation is to treat the lesions, because if it's a lesion, then it's bacteria, so you should not live like this for a long time, okay? Maybe it's healing, that's why you would follow up, okay? Very good. So check this recommended reference. It's a very good article about the outcomes. So the relationship between the extent of your endodontic treatment and then the outcome. All right. So this article is concluding that underextended and overextended endodontic treatments have higher chances to lead to unfavorable clinical outcomes, but there is still a lot of things to be clarified in the literature. So the papers have bias, and it's not so simple to conclude that. When you guys read this paper, you guys will realize that even in the conclusion of the paper. Okay, so if you guys like, please hit the like button. Don't forget to subscribe and join our team here, because we are here doing our best to offer you a very nice content, and see you guys in the next videos.